Chronic hepatitis C infection affects more than 3.5 million people in the U.S., many of whom may be unaware of their infection. Chronic hepatitis C is a real issue for America's veterans. More than 174,000 suffer from it. In advance of World Hepatitis Day, which is July 28th, Dr. Stephen Harrison, a nationally recognized hepatologist, is here to discuss hepatitis C. Dr. Harrison, thanks for joining us today.
Hey, thank you for having me on the show today. It's an honor to be here and to speak to veterans, particularly relating to hepatitis C. As a former active duty physician myself in the Army with 21 years on active duty, it's an honor to be able to speak to your listeners.
All right, Dr. Harrison, what is chronic hepatitis C?
Well, chronic hepatitis C is a chronic liver disease that can lead to cirrhosis and liver cancer over time. It's a silent disease. Most people with this disease don't have symptoms until their liver disease gets to the point that they begin to manifest things like fatigue or jaundice or yellowness of the eyes and that sort of thing. The disease affects approximately 3.5 million Americans in the U.S. today. And more importantly, it affects about 174,000 U.S. veterans, many of whom live in your viewing area. This represents about 5.4% of the overall veteran population, and that's about 3 times higher than the general population.
Now, what is driving this chronic epidemic?
This chronic hepatitis C epidemic is being driven by risk factors that increase patients' probability of getting hepatitis C through the spread of virus in blood products. So prior to 1992, we weren't routinely screening blood for hepatitis C. And so that's a risk factor. If you had a blood transfusion prior to 1992, you may be at risk for hepatitis C. Additionally, the CDC has recommended that patients in this birth cohort, this so-called baby boomer generation, if you were born between 1945 and 1965, about 75% of all the hepatitis C is kind of congregated in that group of patients. So that's a risk factor in and of itself. For our U.S. veterans that deployed downrange to combat zones in Iraq and Afghanistan and even Vietnam, where they may have been exposed to blood products, that's a unique risk characteristic for that population. Another risk factor, or group of risk factors that are unique to veterans and the U.S. population as a whole, would be IV drug injections or IV drug use, would be body piercings or tattoos with contaminated needles, and also sharing of razor blades or toothbrushes with people that have active chronic hepatitis C infection, or additional risk factors, as is incidental needle stick injuries in our healthcare workers. So those all together are unique risk factors that put people at risk for hepatitis C.
All right, Dr. Harrison, how can people, veterans of course in particular, get tested and treated for this disease?
Well, that's a great question. And testing for this disease is very simple. You go to your doc and you say, hey, I need to be tested for hepatitis C. I have risk factors that made me think I need to be tested.
Yeah.
And it's a simple blood test. It's a blood test the doc can do that's highly accurate, and it comes back very quickly and will tell you whether or not you have the disease.
Now, how has screening and treatment of hepatitis C evolved over the years?
Well, the evolution of screening and treatment has been dramatic. The way we screen for the disease now is with a simple blood test that's highly accurate at telling us if you have the disease. As far as treatment goes, this has been just an all-out revolution. We've gone from curing about 40% of people 10 to 15 years ago with therapies that included shots and pills taken for a year in some cases with lots of horrible side effects, to now we target the virus directly. We're able to achieve cure rates more than 95% in almost all the cases, with treatment as short as 12 weeks with minimal to no side effects.
Now, why is it important for all people to speak to their doctors if they think they may be at risk?
I think the driving point here about the importance of speaking to your doctor about hepatitis C is that it's a treatable condition. It's a curable condition. And the amazing thing about the liver is if you can resolve the injury that's being caused by hepatitis C, the liver will heal itself over time. So it's all about getting into the doc before it's too late, getting tested and treat it if you have the disease, and allowing the liver to then heal itself.
Dr. Harrison, finally, what is the significance of World Hepatitis Day for increasing awareness of this disease? And follow up on that, where can you get more information also?
Absolutely. So World Hepatitis Day was established just to deliver the information about disease state awareness, to point out that it's a silent disease, to point out the risk factors for the disease, to point out that testing is very simple and can easily be done with your local doctor, and that treatments are available to cure the vast majority of this disease. To learn more about hepatitis C, particularly if you're a U.S. veteran, go to the VA website, www.hepatitis.va.gov, and there you'll find more information about this disease.
Dr. Harrison, thanks for joining us. Some great information today.
Thanks so much for having me on your show.